Welcome back to the Exam Room Nutrition Podcast. I'm Colleen, a PA, dietitian, and your nutrition mentor. I hope you've been enjoying these shorty episodes in our mini-series called Deficiency Detectives. As you know, for the next 2 weeks, I'm dropping an episode every Wednesday, Thursday, and Friday, in which you're presented with a curious patient case, and your job is to guess which nutrient deficiency might be causing our patient's symptoms. Here's what makes it fun. You can submit your guess online and receive instant feedback from me. Now, yesterday you were presented with case 2, a 69-year-old vegan on levothyroxine with achy muscles, dry skin, and tingling lips. And I'm about to reveal the answer. Now, if you submitted your guess online, you should have received an email from me, and you're officially in the running for an amazing prize. 1 year of complimentary access to Nutrition Grand Rounds. This monthly virtual workshop launches in January, and it's packed with expert nutrition presentations you won't want to miss. But if today's your first day joining us, no worries, you're not behind. Each episode stands alone, and there's still plenty of time to get involved. Now, after going over yesterday's case, at the end of this episode, I'll present a new case for you to solve. And you can head over to examroomnutrition.com/Fred to submit your answer today. And if you do, you'll get exclusive cheat sheets, resources, and be entered into our giveaway. Also, if you're loving this series, can you tell a friend about it? I need your help growing my show to a larger audience. So just grab the link to this episode and send them a quick text so they can participate too. All right, detectives, it's time to reveal the answer to yesterday's mystery. So what was Lena's deficiency? If you guessed calcium, you're right. Calcium is the most abundant mineral in the body and plays a vital role in many bodily functions, from forming and maintaining strong bones and teeth to supporting muscle contractions, nerve transmission, and vascular functions. Approximately 99% of the body's calcium is stored in bones and teeth, with the remaining 1% in blood, muscle, and other tissues where it aids in cellular functions. Now let's unpack the common symptoms of calcium deficiency. Known as hypocalcemia, calcium deficiency can range from asymptomatic to severe complications depending on the extent and duration of the deficiency. Now, some early symptoms may include muscle cramps and spasms, particularly in the back and legs. Now, patients might describe this as stiff or achy muscles. They can also have tingling or numbness in the lips, fingers, and the feet. Patients can also have dry, scaly skin, brittle nails, and coarse hair. Neurological symptoms appear in advanced deficiency and can include confusion, depression, forgetfulness, paresthesia, seizures, and in severe cases, hallucinations or delirium. Now, long-term calcium deficiency can lead to more serious complications like rickets, osteoporosis, osteomalacia, and an increased risk of fractures due to decreased bone density. Now, several factors may predispose individuals to calcium deficiency. The first one is age. Older adults have an increased risk due to decreased bone density and lower calcium absorption rates. Number 2 is menopause. Women undergoing menopause experience a decrease in estrogen, which is essential for calcium absorption, and an increase in urinary calcium, placing them at higher risk. On average, women lose approximately 1% of their bone mineral density per year after menopause. Number 3 could be dietary restrictions. Vegetarians and vegans, especially those who do not consume dairy products, may not get enough calcium in their diets. Number 4, lactose intolerance. Now, individuals who avoid dairy often struggle to meet their calcium needs. Number 5 is certain medical conditions like Crohn's disease, celiac disease, and kidney disease, which can all impair calcium absorption. Lastly, medications. There are several medications that can interfere with calcium absorption, notably PPIs, iron supplements, thyroid hormones, like our patient Lena, beta blockers, and diuretics. Now, hypocalcemia can also be a result of vitamin D or magnesium deficiency, impaired parathyroid hormone production, leading to hypoparathyroidism, impaired bone reabsorption of calcium, or critical illness. So, what are some sources of dietary calcium? Now, for patients following plant-based diets who don't consume dairy products, calcium can still be sourced effectively through certain foods and fortified products. So a few high calcium options include fortified plant-based milks. Many almond, soy, oat, pea, cashew, and rice milks are fortified with calcium, so they provide comparable amounts to dairy milk, which is about 300 milligrams. If your patient is choosing to have a plant-based milk, make sure the patient knows how to review the nutrition facts label to make sure that there isn't an excessive amount of added sugars. Now, here's a pro tip that will make you look like a genius. Instruct your patient to shake the plant-based milk container well before using it, as the calcium can often settle to the bottom. Another great option are leafy green vegetables. Collard greens, turnip greens, bok choy, and kale offer calcium, but it's slightly lower bioavailability than dairy. Each of these options have about 100 milligrams per serving. Fortified cereals and juices are also a great option. These are excellent sources of calcium, with orange juice coming in at about 300 milligrams, and certain cereal brands have about 130 milligrams. Tofu and tempeh, especially those that are made with calcium sulfate, can contain as much as 200 milligrams per serving. Nuts and seeds like almonds and chia seeds, which have about 75 milligrams, and some sesame seeds can contribute to calcium intake, but often they do need to consume these in larger amounts. Now, if your patient is a pescatarian or flexitarian, canned sardines and salmon with the bones are great sources, coming in at about 325 milligrams. Now, it's really important to understand calcium bioavailability. Calcium absorption can vary significantly depending on the food source. For example, calcium from dairy products and fortified foods is absorbed at about 30%. Now, by contrast, certain plant compounds like oxalates, which are found in spinach, Swiss chard, and rhubarb, and phytates, which can be found in legumes and grains, can actually bind with calcium, and they can form insoluble salts that decrease its absorption. As a result, calcium absorption from spinach, for example, is only about 5% compared to 27% from milk. Now, there are some leafy greens that are lower in oxalates, making their calcium more bioavailable. Kale, turnip greens, and mustard greens have absorption rates closer to those of dairy, even though their overall calcium content per serving is lower. Now, other cruciferous vegetables like broccoli and cabbage also provide some calcium with similar bioavailability to milk. Now, all that to say, don't confuse your patient or hyper-focus on, quote, low oxalate foods. And we're not even going to go down that rabbit hole right now. But instead, I would encourage your patient to focus on getting calcium from a wide variety of foods. It's really the best way to help them meet their needs. So what's the treatment for calcium deficiency? Now, this generally involves dietary adjustments to increase the intake of calcium-rich foods or a calcium supplement if necessary. Now, for adults, the recommended dietary allowance, or RDA, is 1,000 milligrams per day for men and women aged 19 to 50, and 1,200 milligrams per day for women aged 51 and older, and men aged 71 and older. Now, in cases where dietary changes are insufficient or your patient has a really limited diet, you can consider recommending a calcium supplement, preferably calcium citrate or calcium carbonate. All right, here are a few final education suggestions that your patient would benefit from. I would definitely highlight the importance of consistency. Calcium should be consumed throughout the day as the body absorbs it more efficiently in smaller, consistent amounts. I also would suggest diverse sources. Although dairy is a great source of calcium, there are many plant-based alternatives that can meet calcium needs. So there is no need to shame or scare your patient into eating foods that they don't feel comfortable eating. You can also discuss supplement options, but if you are going to recommend a supplement, help your patient understand how to take it effectively and the recommended dosage for their age and lifestyle. I would also highly encourage weight-bearing exercise. For older adults and those at risk of osteoporosis, this can help build and maintain their bone density. Lastly, make sure you are monitoring for any medication interactions. Calcium can interact with several medications, which can potentially lower the calcium absorption or affect the drug efficacy. And now you'll look like a genius when you correctly diagnose a patient with calcium deficiency. All right, detective, are you ready for your next case? Let's meet Fred. He's a 52-year-old man presenting to the emergency department with a range of unexplained symptoms. Fred is a recovering alcoholic who reports being sober for the past 6 months. He has a history of gastric bypass surgery about 3 years ago for obesity and reports he has struggled to maintain a balanced diet post-surgery due to some ongoing nausea and his low appetite. He's not currently taking any multivitamins or supplements. Now, in the past several weeks, Fred has noticed increasing fatigue, difficulty walking, weight loss, and frequent episodes of confusion. On physical exam, his gait is unsteady, and he has diminished sensation in his feet. His reflexes are sluggish, and his mental status is notable for disorientation and memory gaps. His family reports that he has become forgetful and sometimes fabricates details of events. He is also experiencing mild shortness of breath and swelling in his lower legs. All right, detective, what vitamin is Fred deficient in? Here's a hint. Wernicke's encephalopathy and Korsakoff syndrome are both late-stage neurological complications of this vitamin deficiency. And that's it for today's Deficiency Detective. Now head on over to examroomnutrition.com/Fred to submit your guess and win a chance for free access to the Nutrition Grand Rounds. I'll respond immediately with the correct answer. For those of you who don't want to submit your guess, you're going to have to come back to me on Wednesday next week when I'll reveal the answer to today's case. I'll break it down for you and share actionable tips that you can use with your patients right away. Plus, I'll introduce you to your next case. All right, I will see you next time, detectives.